Chapter 21, the lymphatic system, screencast 2. This screencast is focusing on lymphoid structures. The previous screencast focused primarily on the vascular components of the lymphatic system. This will be the structures. When we talk about lymphoid structures, they're going to be divided into two subcategories. They're going to be described as either primary lymphoid structures or secondary lymphoid structures. Primary lymphoid structures are those structures that are involved in the formation and maturation of lymphocytes, and examples of these are going to be the red bone marrow and thymus. Secondary lymphoid structures, on the other hand, they do not form lymphocytes. They will house lymphocytes and other immune cells, and they quite often are where the immune response is actually initiated. Examples of structures that we consider to be secondary include the spleen, lymph nodes, lymphatic nodules, tonsils. Another category would be what we refer to as MALT, and MALT stands for mucosa-associated lymphoid tissue or mucosa-associated lymphatic tissue. The first primary structure that we're going to address is red bone marrow. Red bone marrow is that marrow that is located between the trabecula of spongy bone. Examples would be the flat bones of the skull, ribs, the sternum, vertebrae, and also the heads of the humerus and femur, just to give a few examples of where red bone marrow is located. The primary function of red bone marrow is hematopoiesis. And remember, that is the term used to describe the production of formed elements of the blood. We will put the emphasis primarily on those formed elements that are T lymphocytes and B lymphocytes. You may quite often hear them referred to as T cells and B cells. Now, the T lymphocytes, they will actually migrate to the thymus, and that is where the maturation of T cells will actually continue. The thymus is the other lymphoid structure that we consider to be primary. It is found in the mediastinum, and one thing to remember here is that the thymus is much larger in children than adults. Anatomically, it is made up of two thymic lobes, and each of those lobes are surrounded by a capsule made up of connective tissue. Within the capsule, we're actually going to see lobules, and that is subdividing the lobes into smaller components. When we look at the cortex of the thymus, that is where we expect to find immature T lymphocytes, and it is in the medulla where we will find those that are actually mature. What we see here is the micrograph of a child and comparing it to the thymus of an adult. On our left, we can actually see the thymus that's found in a child, and we can see that there's a lot of active tissue. On the right, we're actually looking at the micrograph of an adult thymus, and you can see how infiltrated it is with adipose and connective tissue. We're now going to move on to those structures that we consider to be secondary. And remember, these are going to be those structures that house lymphocytes and other immune cells, and generally they're going to be found within a reticular connective tissue matrix. And when you are covering histology, reticular tissue is not one of those big tissues, and it generally is limited to lymphoid structures. Now, we're going to subcategorize secondary lymphoid structures into two different types. We're going to be looking at lymphoid organs and then aggregates of lymphoid nodules. What differentiates an organ from nodules is going to be that organs have a complete capsule of dense irregular connective tissue. They are going to be the spleen and lymph nodes. Other lymphoid structures will have an incomplete capsule or not have one at all. So these would be our tonsils, MALT, and also diffuse lymphoid nodules. Now, the role of lymph nodes is actually to filter lymph. They're going to be removing unwanted substances from the lymph itself. They are basically small, they're oval, and they're encapsulated. Now, one thing to keep in mind as a filter, because they're arranged in a network, think of it as a multi-layer filter. And we're going to find them deep along deep and superficial pathways of lymph vessels. And as I said, they typically are going to be found in clusters, receiving lymph from various regions of the body. The primary lymph nodules are found within the cervical area, and they are going to be receiving lymph from the head and neck. The axillary lymph nodes are receiving lymph from the breast, axilla, and upper limb. And the inguinal lymph nodes are found in the groin area, and they're receiving lymph from the lower limb and pelvis. Now here we're actually looking at a figure of a lymph node, and there are a couple of things that I want to point out here. Now keep in mind we're talking about a structure whose primary job is to filter. So there has to be a way in which we see pressure increasing. And that is going to be accomplished if you look at the number of ways to get in versus the way to leave. You'll notice that there are many afferent vessels actually bringing lymph to the node, and there is only one efferent lymphatic vessel that is actually leaving the lymph node. So it's easier to get in than it is to leave. So lymph will actually accumulate and form a hydrostatic pressure, which will drive the filtration process. Now, there are a couple of terms that I want to point out here, and we have addressed some of them already. One that I want to point out is a hilum. A hilum is an area, so it's a region where we are going to see tubes enter or leave the organ. So here we can actually see that efferent lymphatic vessel, the concave, and that is going to be a region known as the hilum. We also talked about the cortex, and that is going to be the outer area, and the medulla is going to be that inner area. So some real general terminology that you want to be familiar with, because I'm going to use those terms for structures when we talk about in the anatomy portion. And so once again, we can see that the lymph node is subdivided into compartments, and that is actually accomplished through those trabeculae. And we've talked about that previously when we talked about the thymus. Now the cortex, this is the outer area, and we're going to find these reticular fibers, and they're going to support what we refer to as a germinal center. In this center, you're going to find proliferating B lymphocytes and some macrophages. They're going to be surrounding what we call a mantle zone that contains T lymphocytes, macrophages, and dendritic cells. Within the cortical sinus, there's these tiny open channels that are going to be lined by macrophages. Now, another thing that we can refer to is the medulla is going to have what we refer to as medullary cords. So these cords are these connective tissue fibers that are supporting B cells, T cells, and macrophages. And if we look at the sinuses that are found in this particular area, they're going to be these tiny open channels that are actually lined with macrophages. So keep in mind, we're really talking about structures that have a fair amount of immune cells. So I want you to keep that in mind, because this is going to be the anatomical system that contributes significantly to the functional system of immunity, which is chapter 23. Now, keep in mind what's happening with lymph nodes. The lymph will actually flow through these various nodes, and remember, it's going to enter a node through one of several afferent vessels. And remember, because there's all these different ways or multiple ways to enter the lymph node, this actually creates a pressure or a hydrostatic force that is going to move that lymph through the node and to the efferent vessel so that it can leave the lymph node and then probably go into another lymph node. So once again, it's a elaborate filtration system. Now, the thing to remember here is lymph is filtering lymph, and it is also monitoring lymph for the presence of things that just don't belong in our body. There's going to be macrophages, and they are going to get rid of debris that's found within the lymph. Lymphocytes may actually initiate an immune response. And when we talk about the lymph nodes, kind of imagine you're going in for a physical exam, and a general part of a physical exam is for the physician to palpate the lymph nodes. And they're doing this because if there is an infection, the lymph nodes will be swollen due to a proliferation of lymphocytes that are responding to an immune response that has been initiated there. And then when this process is completed, we're actually going to look at the lymph. It's going to be leaving through that efferent vessel. And as I stated previously, it's going to potentially enter into neighboring lymph nodes because, remember, they're connected as a network. Now, there is one cancer in particular that is tied into lymph structures, and it is known as lymphoma. And here we're looking at what they refer to as a malignant neoplasm, and that's from the lymphoid structures. Generally, you're going to have a non-tender enlarged lymph node, and symptoms that are quite often associated with lymphoma are very general. So night sweats, fever, weight loss. These are symptoms that are associated with many other types of disorders or diseases. And so it is important to keep in mind when we are talking about identifying cancer, the best prognosis is to find it early. And I've shared this with you before. My younger brother is a survivor of Hodgkin's lymphoma. He was diagnosed as a child. He was an adolescent. He was a junior in high school. And basically, they discovered his Hodgkin's lymphoma late stage 3, early stage 4. So it was a fairly progressed disease. And because of how he was treated, it has resulted in quite a few problems that he experiences to this day. He had a heart attack at the early age of 40. And typically, a heart attack is due to other types of damage, diet, lifestyle, but that was not the case here, okay? And generally, when we look at Hodgkin's lymphoma, the typical treatment plan is removing it through surgery, radiation, and then chemotherapy if necessary. The population that is most impacted by Hodgkin's lymphoma are going to be young individuals and people over 60. So basically opposite ends of the age spectrum, but not really talking about young children. There is another type of lymphoma, and it is actually known as non-Hodgkin's lymphoma. And this is the type of lymphoma that is much more common. And there are subtypes, some being more aggressive than others. Now, here we're looking at the second of the lymphoid structures that we consider to be organs, and it is the spleen. The spleen is located in the upper abdominal quadrant, and what we want to keep in mind here is it's going to be very similar. Okay, it has a hilum, it has that concavity, and here we can actually see the vessels, okay, that are entering and leaving the spleen. Now, one thing to keep in mind here is it has a complete capsule. That's why it's considered to be a lymphoid organ. And if we take a look at the inside, we're going to notice that once again, we see these trabecula that are coming from the capsule, and they are going to be extending into the spleen. And what these trabecula are dividing the spleen into are going to be areas of what we refer to as red and white pulp. Now, when we talk about the tissue, the white pulp is going to be clusters of T cells and B cells and macrophages, and they're going to be around what we refer to as a central artery. And we can see that here, okay, the central artery and the lymphoid tissue around that. Red pulp, on the other hand, that is going to contain red blood cells, platelets, macrophages, and B cells. And because of the erythrocytes and platelets, that's why it is referred to as red pulp. And there are going to be these structures within the red pulp that are known as splenic cords, and there are going to be cells and reticular connective tissue found in the red pulp. Also, we're going to have these capillaries in the splenic sinusoids, and they're very, very permeable capillaries. And this is going to be where we actually see a storage site for red blood cells and platelets. Now, the job of the spleen is different than that from the lymph nodes. Remember, lymph nodes are about filtering lymph. Spleen, on the other hand, is going to be filtering and monitoring blood. The white pulp will be monitoring for foreign materials and bacteria. There will be macrophages in the sinusoids of the red pulp, and they're going to be removing particles. So what they might be doing is phagocytizing bacteria, debris, and defective erythrocytes and platelets. Remember, when we are talking about red blood cells, the area where they are typically broken down and constituents are going to be recycled for the formation of new red blood cells, the two organs where that process takes place is going to be the liver and the spleen. So here we actually see the role that the spleen is playing with respect to that process. Now, when we look at the flow of blood, blood will be entering the spleen through the splenic artery, the central artery, sinusoids, venules, and then leaving the spleen through the splenic vein. Now, remember, the overall function here is to remove foreign particles and digest via macrophages, get rid of defective red blood cells and platelets, but also you might refer to the spleen as the red blood cell graveyard. Okay, that kind of is where we see clearing defective red blood cells and so on. But it is also an area where we find a storage of erythrocytes and platelets. When we look at the first 5 months of fetal development, the spleen actually plays a role in the production of blood cells. Now, because of the position of the spleen, it may have to be removed surgically. Probably the most common reason is it's ruptured from abdominal injury and trauma. Kind of imagine the position. So it's not uncommon that the spleen may be ruptured in an automobile accident and other types of trauma overall. It might have to be removed because of an infection or a tumor. It could be removed because of lymphoma or some other type of cancer. One of the things that was done, or how my brother was treated during his Hodgkin's lymphoma, his spleen was actually removed, so he does not have a spleen. Another area that we might see it removed is due to blood disorders, primarily sickle cell anemia. Now, I want to be careful with the last statement here that appears on this slide, that individuals that do not have a spleen are more prone to life-threatening infections. This is not a well-conducted study, and this is just anecdotal evidence. Just from experience with my younger brother, he has not been prone to any infections that are really life-threatening. He has had lots of other problems, but never has he really experienced an infection that is life-threatening or very severe. Now, we're moving on to tonsils, and there are actually 3 sets of tonsils. Within the nasopharynx, we're going to find the pharyngeal tonsils. You may quite often have heard of the pharyngeal tonsils referred to as adenoids, and that's what they're called when they become enlarged. We have the palatine tonsils, and they are going to be in the oral cavity. And then we have the lingual tonsils, and they are going to be posterior along the tongue. Now, when we look at these tonsils, once again, remember they are secondary lymphoid structures because they do not have a complete capsule. And we're going to find a structure known as tonsillar crypts. And these crypts are actually invaginations, and they contain lymphoid nodules. And some of them may actually have germinal centers. Now, I want to take a step away here because I want to address a relatively important concept. One thing that I think it is to remember that we should not be surprised that whenever we find a gateway or entrance into the body, there has to be some type of immune presence. And generally, this is going to be some lymphoid structure. So kind of think about the positioning of the tonsils. Okay? Tonsils are found in the area of the pharynx, okay? And so that is how things come into the body. So it kind of makes sense that there has to be some type of a immune presence there to protect us. Now here, what we're looking at is a tonsil that is actually inflamed and infected, and the tonsils that are most commonly impacted or infected are the palatine tonsils. So generally, when they are infected, they will redden and enlarge. And the issue here is that they may actually obstruct the pharynx. So it may become difficult breathing, eating, swallowing, and so on. And generally, symptoms are going to be a fever. There could be chills, and unsurprisingly, a sore throat. But as I said, depending upon the degree of swelling, another symptom might be difficulty swallowing. one of the causes of infection. It could be viral or bacteria. But now, generally, they do not remove tonsils unless it is absolutely necessary. When I was a child, tonsils were removed pretty regularly, but now we are better aware of their function. They are a component of the immune system, and so we really only want to remove tonsils or have them removed when there are these really persistent infections that are creating other issues. Now, throughout the body, we are going to have other lymphoid nodules, and we're basically going to find them in entryways or gateways into the body. And so we're going to think of them as clusters of cells with some type of an extracellular matrix, but remember, they're not organs, so they do not have a complete tissue capsule. They're scattered throughout the body. They are going to be found in every organ. And as I said previously, we can especially expect to find them in any gateway or entry into the body. And as part of the immune system, they play a role in fighting against infection. Now, some areas you're actually going to see them referred to as what we call MAW. And remember, that is that mucosa-associated lymphatic tissue. Now, where we're going to find those, once again, is in the GI tract, the respiratory tract, genital tract, and the urinary tract. And they're found in the lamina propria of the mucosa. Now, the mucosa, when we start talking about structures that have a tube that are not vessels, the mucosa is going to be the innermost layer of that tube. So that is the layer that is actually going to be in contact with whatever happens to be within the tube. So the role of these mucosa-associated lymphoid tissues is really just to defend against foreign substances. Now, when we move on to the digestive system, we're going to encounter another type known as Peyer's patches. And these are found primarily in the ileum of the small intestine. Now, this is a last image of the chapter, and this image is really a nice breakdown of the two primary functions that are associated with the lymphatic system. On the left side, we actually see the lymphatic structures that assist the cardiovascular system with respect to making sure that any fluid that is not reabsorbed at the level of the capillary is put back into circulation as it is picked up by lymphatic vessels and brought back into circulation. The right panel is a summary of all of the lymphoid structures that play a role in the immune system.